going to pivot a little bit and talk about ASCO. I know you're the lead author on the ARC-9 abstract that's presented for oral presentation in colorectal session. Can you tell us a little bit about the design of the study and what we are hoping to hear?
So it's an interesting study design because it has challenged a little bit of dogma that you can't re-challenge with chemotherapy. And I think that one of the ideas behind the ARC-9 study is that that in the community in colorectal cancer, as patients progress and go further and further away from frontline FOLFOX therapy, there has been a tendency to re-challenge with FOLFOX in some of these patients. It's an observation that we made a number of years ago. It's just occurring with a lot more frequency that I think everybody thought, and also that there was no real prospective data. It was just clinical observations that community oncologists and others were observing. And so that's the premise behind the study, is what happens when you re-challenge with FOLFOX chemotherapy, add in some interesting novel agents, which in this case is etruma and zim, etruma being a A2AR inhibitor, part of the adenosine receptor pathway, directly blocking adenosine. And by re-challenging that and comparing it, because it's a randomized trial, to one of the existing standards of care in this, and at the time the study was launched, it was regorafenib, of course. Could we improve outcomes? So suffice it to say, the data is embargoed, but I think it's very interesting data. It was, I like assigning prospective data where none exists. So we'll see how it's received by the community.
Yeah, I'm looking forward to hearing this. Anything else are you excited about at upcoming ASCO?
Yeah, I think it's going to be a good ASCO. I think we have obviously the head-to-head study of FLOT versus carbotaxol radiation. That's part of the plenary. We've already seen that, so that'll be good. I think we've got obviously some really nice studies with in gastroesophageal cancer with some novel antibody combinations and bispecifics and ADCs, and I mean, and also this, over the weekend I heard about this, didn't hear the results, but I heard some buzz around colon cancer and liver transplantation. So
interesting.
If you look at the colon cancer oral session, there's a big presentation on liver transplant and liver predominant metastatic colon cancer. So
talk about moving the needle, huh?
Yeah, well, we'll see how that goes.
Results.
So, yeah, so I think it'll be good.